We want to get to this news because the U.S. has reported its first COVID Omicron-related death yesterday. And this comes as the news that it is now the most dominant strain in the country, with more than 73% of new cases in just 3 weeks. So I want to bring in Dr. Mike. Dr. Mike, if you could tell us what you know about this first COVID-related death and your reaction to the fact that it's now the most prevalent variant that we've seen.
Well, not to be surprised by this, because we knew Omicron was coming. It had a very rapid doubling rate, and it can be deadly. The bottom line is, Alex and Thomas, that if you're not vaccinated, if you have not been boosted, you are at higher risk of having problems. And in fact, if you look across the nation, the people that are in hospitals that are very sick with Omicron are unvaccinated people. So if you look at the data, even though Omicron is coming to a town near you, the bottom line is you will be protected if you get vaccinated and get boosted and do the right thing.
So to clarify, I mean, this.
And I just want to say.
Okay, go ahead.
Go ahead, Thomas.
No, go ahead, Alex.
I just wanted, you're probably going to do the same thing. I just wanted to clarify that from what we do know from the person who died, it was in Texas, 50 years old, a male, and he was not vaccinated.
There you go. I rest my case. Bottom line is, you want to protect yourself, you want to protect your family, get vaccinated. This is nothing to play with. And again, I've said this, Alex and Thomas, to you personally 1 billion times. We don't fear it, we respect it, and we deal with it. The way to deal with this vaccine, this virus, and any variants to come is to do the right thing and get vaccinated. If you do that, you will protect yourself.
And we should just point out, you can still contract the Omicron variant, even if you're vaccinated, even if you have received the booster shot, correct?
Oh, there's no question, Thomas. You can get breakthrough infections. But here's the deal. The way that the vaccines work, they are designed to prevent you from ending up dying and on a ventilator in the hospital and getting very, very sick. And they are quite effective at doing that. Yeah. In fact, Moderna just came out and said their booster it seems to be quite effective against the Omicron variant. Now, that's not to say that down the road we may need another booster, but right now, our vaccines are working quite well.
Well, you bring up a good point. What about those who require a second? A lot of time has gone by here. You received your 2 initial doses here, fully vaccinated. You received a booster shot. What about the 4 to 6 months now, where a lot of people are approaching that window to get another booster? Can they get one?
Well, Thomas, a lot of people are calling my office saying, hey, Dr. Mike, I got my booster like 6 months ago. Yeah. Now what? Well, right now, we don't have any recommendations to do yet another booster. I think we have to wait and see. Right now, as has been stated by Dr. Fauci and others, our vaccines are holding their own. And let me tell you this little anecdotal story. I have about 10 patients right now who are COVID positive, who are home. They're not in the hospital. They're convalescing. Yes, they are COVID positive, but because they were vaccinated and boosted, they are going to be just fine. I have them staying hydrated and doing what we call proning. That's where they lie flat on their stomachs, take deep breaths, and hold it for about 15 seconds. That prevents the lung to get more problematic in terms of the infection. And we learned that early on as one of our little tools, one of our little tricks. Yeah.
Well, in addition to worrying about COVID, and a lot of folks are trying to make tough decisions with this new Omicron variant, even when there isn't a pandemic, there's a lot of holiday stress that happens this time of year, and we see an uptick in heart attacks.
You know what? When I talk to the two of you, it makes me think how wonderful your hearts are. I love your hearts, and you have good hearts. Now, here's a heart right here. Oh, well, thank you. And the bottom line is, it's been well known that if you drink too much, if you have eat too much, you have too much salt over the holidays, you throw in a little bit of stress, that little perfect storm of stuff, if you have underlying heart disease, can lead to an increased risk of heart attack and atrial fibrillation, what we call holiday heart. I can tell you, when I was a resident, every single time, because I was always on between Christmas and New Year's, people would come in with heart attacks, and that's a big time of year for this. So
you gotta take it easy. Yeah.
Gotta take it easy, man.
You have a very colorful heart, by the way, Dr. Mike, and it grew 3 times sizes that day. Love you, Dr. Mike. We appreciate all the insight, the information you give us.
I love you both.